Greetings, my beloved Black people. Welcome to the plight and struggle of Black people in America. As you know, we always have very interesting guests. And you also know that we bring information to the community about the community and always with the intent to be helpful in some shape, form, or fashion. Now we're going to bring our special guest today, and she's going to tell us a lot of good things. Hey, young lady, how you doing today?
Hey, young man, Mr. Gray. I'm great, and how are you doing?
Oh, I'm getting excited about this expo coming up this Saturday.
I'm excited, nervous, all wound up together. We're in the last few days of almost 8 months of preparation. Well, written down several months before 8 months of preparation. So,
that's work, yeah. Right? That's some work.
Work, yes.
Volunteer work at that.
That's exactly what it is. Volunteer.
And see, we all have our passions, and mine is children. And I know you're into the health thing, and then you notice that there's a big gap in health with Black men and other men. It looks like of every ethnic group, Caucasians, Hispanics, or whoever else it appears.
Yes.
So what is the crust of the problem?
I don't know. I don't have all the answers, but I know our men, the average man, don't run to the doctor where a female would do.
Okay.
So I think we're running into the issues, until our men wait till something is drastically hurting them or wrong, and then they go to the doctor. And a lot of things, literally, the phrase "early detection save your life" is correct. If something is caught early, you can treat it better, easier, less invasive, put it like that.
Okay.
Especially cancer and things like that.
So let me ask you this. Did you have your event this coming Saturday at the Hiawatha Williams Rec Center specifically to a problem, or just coincidental? You landed there because it was available? How did the location come to be?
No. It was picked because of the area, the problem that's in the area. Mm-hmm. It comes under this particular area comes under the area code of 75216, which is comes under City Councilman Mayor Pro Tem Carolyn Arnold King's District 4. Comes under State Representative Tony Rose District 110. Mm-hmm. So it has been federally declared a food desert. That means you have to go 20 minutes or more to really just get a healthy meal. You understand? You just can't walk next door, something like that. The life expectancy, again, is in that area is 71 years. That's the average life expectancy. We're just right down the road, north of that, coming downtown, 20 years more, your life expectancy. Things like that. So STDs, chronic illness numbers are high. It says they're third. At one point, they were number one, but third. And all of this can be looked up, with the Dallas Health, Earth Health and Human Services.
So which agency was it that declared this area was a food desert?
It says federally, so that means the government.
Federally. Okay. And that was, I missed that federal word, but it made me wonder, was it Texas? Okay, so the neighborhood that we're going to be in is in that neighborhood to help that area.
Yeah, that's what we want to help the community, help our men. We know that men wait, to go to the doctor. Some men don't want to talk about issues. So we're going to focus on, it's a family expo. We have things for youth and females, but we're going to focus on a lot of things, like we're going to have education about prostate cancer.
What part of Oak Cliff is that?
It's not West Oak Cliff. I think it's considered South Oak Cliff.
South Oak Cliff, okay.
Yeah.
Over there off of, you say, what's the address?
Bunny View. Okay. Right off of Bunny View. Yeah.
Ledbetter? Over that way?
Ledbetter, you can get to it right up. Yeah. Mm-hmm.
Oh, okay. So what type of events are you going to have for the men, let's say, and then we'll talk about the family. But what about the men? What type of actual assistance can they expect to be able to receive if they're
Okay,
willing?
well, okay. One of the organizations we're going to have there is called Men's Equal Rights. And what they do pro bono work with attorneys to help men like having issues trying to see their children and different things like that. They
Okay,
will go in more
beyond health.
detail. Yeah, they will go into more detail. We tried very hard to get the PSA screening, but the guidelines have changed. So
Okay.
we will have someone educated, and we're supposed to have the model where the men can actually look and see the difference in an enlarged prostate. So they will have education on that.
That's
And
interesting.
she will be representing the American Cancer Society because they are working on getting this changed where men can get these PSA screenings for free. So they will be
Okay.
taking names to take up, to the state to get these names changed. That's an initiative.
Okay. And
Um,
I understand they're gonna have different health procedures available.
yes, we're going to have a National Kidney Foundation there. They will be doing the screenings, and they will have the practitioner there
A
to,
person could actually get their kidneys checked to see if there's something wrong with them.
yeah, you just give a urine sample. And from that, and then the nurse practitioner, they will be there and they will, give
And
you the results, tell you need to check with your doctor because we have a lot of people running around with kidney failure and don't know it.
so everything is free. These different tests.
Everything is free. The
Okay.
food is free. We're feeding
Oh,
some food. The food
okay.
is free. Yeah. We're
Yeah.
gonna have
So.
the AIDS Foundation. It's a
Mhm.
global corporation. Their bus will be there.
Okay.
Those testings are private. They're gonna have the rapid AIDS, HIV testing and STDs. The
Okay.
Dallas Health and Human Services offering all kinds of service and nutrition. They have a
See.
diabetes program, everything. They're going to have the COVID shots, the boosters, and all of it, the hepatitis shots. All of that's free. We're going
Okay.
to have the Black Heart Association. That's genetic testing to tell
Mhm.
you some issues with your heart. They're going to do two. They have one where they're going to stick the finger. They can tell you your triglycerides and I think your cholesterol or whatever. But their
Mhm.
buses will be there. They
Okay.
draw blood, and then you will get the results later as
Wow.
to, yeah. So
So
we have worked on this.
yeah, it looks like a great opportunity for some people that
It
otherwise may
is.
not have the resources to get these type of tests even.
Yeah, it is. We're going to even have one guy. It's called I think it's the Free Lux Project.
Hmm.
He said he's been HIV for living with it the last 11 years. He will be
Okay.
on the ground and he will have, I think, on his T-shirt, and you scan it, and
Hmm.
he will hand you a test that you can take home privately and test
Okay.
for HIV. So
Yeah.
we're going to have Dr. Miller with a PhD, and then
Okay.
she have about 6 sets of letters behind her name. Therapist, she had her own private practice in Frisco
Okay.
that's dealing with the mental and all of that. Therapist,
Right.
we're gonna have
Right.
another professional therapist there. Uh, so many organizations. I just had to turn an organization down yesterday.
Yeah. And I know you mentioned something about men with breast cancer. I think you're gonna have a couple of male breast cancer survivors, if I'm not mistaken.
That's what we're gonna do. We were trying to have 3 or 4. When you're out of treatment and in treatment, you have side effects. But we're gonna have
That's great
uh,
information.
I call him Big Mike, but Reverend Mike, he's going to be there. He is a 19-year African American male breast cancer survivor. He will
Wow.
be on the grounds talking.
Hmm.
As I stated before, 1% of males are diagnosed with breast cancer, but out of that 1%, more African American men die from it.
Mm.
We have to really do something to change those numbers.
Yes. And now I noticed you said do something. If I'm not mistaken, you say nutritional values is significant as well as the mental capacity.
That's it. What this here and what you're putting in your body, we're gonna have to make some changes. What we're
Right.
eating and
Right.
let some of the stress go. So that's why we're gonna have a therapist there. We're gonna
Mm.
deal with all of it. We're gonna have a pre-needs person. You don't worry, try. We're gonna have and the insurance will be there. We will be talking about wills and power of attorneys and the importance of putting all your documents in order in case you get incapacitated. All of that.
That's great.
We're going to have hard help.
Do you have any idea what even led up to that federal situation where they concluded that areas are food deserts? Do you know what triggered that study even?
I can't tell you what triggered it, but it would have to be with the health numbers, I would think. I haven't gotten that detail into it because I try not to get off in the medical. I just know,
and somehow they linked and noticed that places that don't have fresh food available, those areas tend to suffer. In the health capacity.
We're going to have the Oak Cliff Veggie Project there. We're not going. We would love 1,000, 3,000 people. But we're gonna give out fresh veggies, bags of fresh veggies, and I'm not for sure if it's gonna be fruits. Until they're gone.
Okay, that's great. And what time does it start and end? The event?
It starts at 10 a.m. and it ends at 3 p.m.
Okay, so is parking plentiful?
Yes, you can park on the road. People gonna be coming and going. There's a back parking, the front parking. We have to keep for our buses. Help because we was actually going to have 4, but the American Red Cross won't be there to do the blood or whatever in another one. So, but the front parking right in the front of the building, the Black Heart would be there, and the AIDS Foundation bus will be there, and then we have some vendors out there because we have lots of vendors. And we're not trying to sell anything. We are here to assist. We're going to offer education, resources, and referrals to people.
Right. So y'all connecting them to resources, what you're doing, connecting people that need certain helps that don't necessarily know how to get them, but you're going to guide and direct them to these resources.
That's it. Because 311 will be there from Dallas, city of Dallas, because we are doing this in collaboration with the recreation in the city. The code, I think code enforcement is supposed to be there. There's another organization. I'm not quite for sure how many, because we had to actually cut down because we lost part of the venue because there's a basketball thing. But we're going to have 20 to 23 different organizations there. My organization, my table will be set up, RMT Council Network, and education and resources for someone going through cancer.
Oh, that's great. Wow. Because I can imagine, when you're physically hurting or sick, you need some mental help, I suspect. I think I would. That's probably my biggest
why we have our therapists there. And it's not always that you need a pill. Sometimes you do have to balance, the meds and the talk, but then, they're there. We're not trying to just diagnose anyone, the therapists and whatever right there, but guide and direct.
Guide and direct, what's available and how they can attain that help. And that's a great thing. See, that's one thing that's so great about people that love helping people. That's what they do. That's what's so great about them. They do what they're about. They're about helping people, and they live each day to try to help somebody in some shape, form, or fashion. And I'm that same type, and I've noticed people that are like that, they gravitate towards each other. That's what happens. That's what happens. Maybe that's how that birds of a feather situation got started, right? Like-minded, so many different things.
Like-minded people flock together. Yes.
So I'm looking forward to the event and to see the people show up. And I notice it's a men focus on health, but it's also going to be events for children and women as well. We're going to have a popcorn machine there. We have some little fun activities. We're going to have a recovery company there, the Phoenix, substance abuse recovery. We're going to have the match. They're going to be swabbing to bone marrow to save someone's lives. Right.
Kidney, Southwest transplant. Instead of burying our kidneys and organs, we need to donate them to save people's lives. They're going to be there. Yeah, these are national companies.
So hopefully it becomes annually. Who knows?
Well, no, we're not going to hopefully it's going to become annual. That's too long. Once I finish this, give me a week to rest, and I'm going to look to secure another location. when you have to turn down organizations out trying to help people in the community, you can't do it yet. So this is my first time, our organization, RMT Council Network, first time doing anything this large.
Okay.
I participated in other art, health fairs where 3,000 to 4,000 people come. Other states, here in Dallas, been out with some of the politicians or whatever. But this person planned this, directed it, and everything with a handful of volunteers. So I know, some of the hurdles now. So give us 3 to 4 months. We got to hit West Dallas. We got to hit South Dallas.
Absolutely.
We have to hit Pleasant Grove because those numbers are in those areas also.
Okay. Because I noticed you said this area used to be first at worst, now it's third.
It's third. That's what it says. Third.
Right.
Yeah.
So there's
about 4 years ago, it had the highest death numbers out of every zip code in Dallas for breast cancer. They were dying. Those numbers have went down. But out of all the zip codes in Dallas, Texas, it had the most deaths from breast cancer women died from.
Wow. That's serious.
So we know something changed. And so, that's what we have to do. Just continue to do our little part.
Due diligence. Yes. I thank you, and a lot of other people will be thanking you. I'm certain of it.
Thank you. Thank you. I appreciate your support.
Yeah, and I hope that you invite me to every event that you do have. I like to be
You
there.
have an open standing invitation, sir. Yes, you do.
And
your organization, we're telling them about it. So wait a minute. I was like, he's gonna take you out to a farm, a ranch, or something. I couldn't remember what it was, but I know. And I said, you're gonna learn some things, So
actually, we got it set up for July 22nd, and we're inviting some people, and they can bring family, children. So we're gonna see how that goes. I know it's gonna be great.
Can I come along too?
Absolutely.
Okay.
Yes, ma'am. Okay. I thought I sent you the information, but I'll send it to you right after we finish this.
Okay. Great.
And you can invite friends and family.
Okay.
Well,
okay.
All right. Well, thanks again, and the community appreciates you for all that you do.
Thank you. I appreciate you. Thank you for your support. You have a great day now.
Thank you, and you do the same.
Thanks. Bye-bye.
Bye-bye. Okay. It's always good to have the mindset to want to help somebody, especially if you can help somebody help themselves. The plight and struggle of Black people in America. Please subscribe, like, and share. Have a pleasant day. Black people united.